Nikita. I'll be your nurse today. I hear you're getting discharged after having your baby. Congratulations. I just have a few things to go over before you get discharged. So, Mom, it's recommended that you have good nutrition. That's good for your body to heal. You should eat foods that are high in fiber, including bran, broccoli, cauliflower, and fruits to help your bowel movements become regular. Eat foods rich in calcium, which include dark leafy green vegetables, milk, yogurt, and drink plenty of water and non-sugar supplemented juices each day to satisfy your thirst and maintain hydration. It's recommended that you avoid drinking soft drinks, coffee, tea, and alcoholic beverages, especially if you decide to breastfeed. For your activity level, gradually increase your daily activities until you're back to your normal routine, but rest frequently. No overexerting yourself, no lifting, pushing, or pulling for the first 2 to 6 weeks, or as instructed by your physician. Do not drive until you are released by your physician to do so. For breast care, if you decide to breastfeed, your breasts and nipples may have changed, grown in size during your pregnancy. Wear a well-fitted supportive bra day and night that might be comfortable as your body adjusts to these changes. Wear breast pads until your breasts stop leaking, and leaking may occur for several weeks to months. You may apply ice packs between feedings to ease discomfort. If you're not breastfeeding, wear a well-fitted supportive bra for at least 3 to 4 days following delivery. So you could wear like a tight sports bra. You can even use ace bandages to wrap yourself, and try to refrain from stimulating the breasts and nipples. Do not pump breast milk or permit the newborn to suckle to alleviate engorgement. Apply cold compresses in the form of a frozen wet towel, cold pack, or ice pack for 15 minutes at a time, every hour as needed. To prevent tissue injury, do not apply the cold directly to the bare skin, and don't massage or apply heat to the breasts. It's also recommended when you take a shower, face away from the water, and have the hot water go along your back and not your breasts, as the hot water and the stimulation can cause you to release milk. For breastfeeding tips, if you decide to breastfeed, your baby's mouth should form a tight seal. The lips should be against the areola and not the nipple. If the baby's suckling incorrectly, slide a finger between your baby's lips and your breast to break the suction gently, and reposition and try again. How long should you nurse, you ask? As long as your baby wants, which typically happens around 10 to 30 minutes. At first, your newborn will probably want to nurse many times in the 24-hour period, though not for very long. Probably about every 2 to 3 hours. It is important for your health of your breasts that your infant feeds from both breasts every feeding. Good signs of nursing is hearing your baby swallow without a clicking sound, and even seeing movements above the baby ears. They might even wiggle. And not seeing dimples in your baby's cheeks. You and the baby should appear calm and relaxed during the feedings, and you should gently feel tugging at the nipple, but no pain after the first few minutes. If you do feel pain, it may mean that the baby is not positioned properly or that the tongue does not extend past the lower jaw. Remove the baby and begin again. But again, use your finger so you can break the suction, and it'll avoid irritation in the long run. For hygiene, it's recommended that you frequently wash your hands as you're caring for yourself. To prevent infection, always wipe front to back. And after going to the bathroom or having a bowel movement, it's also recommended that you clean your bottom with a warm tap water using the Perry bottle provided after you urinate or have a bowel movement. It is important that you change your pad frequently, so it's mainly recommended that you change your pad every time you go to the bathroom, and don't worry about wasting them because it's all about preventing infection. For bleeding, your vaginal flow will decrease in an amount from bright red to pinkish to a brown or to a yellow cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of the baby. Your bowel movements. So it's recommended you avoid constipation, such as by taking mild laxatives, stool softeners until your bowel movements have returned to your normal pattern, and increase fluid and fiber in your diet. For birth control, you can discuss your options with your healthcare provider, and you may choose to obtain a method of birth control before resuming sexual intercourse. For sexual activity, nothing should go into the vagina the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and the woman feels physically and emotionally ready. And so I have a few warning signs that you should immediately report to your healthcare provider if you notice. First sign is if you feel any pain, redness, warmth, swelling, drainage, or foul smelling discharge from the incision or the incision sign begins to open, such as your perineal laceration or C-section incision, immediately contact your healthcare provider. If you notice that the discharge from your vagina has a bad odor, also notify the provider. If you have a severe headache, blurred vision, or visual changes, a temperature over 100.4, or you feel cold, feverish, and have chills, or if you feel any pain, burning sensation, redness, warmth, or swelling in the legs. If you have any thoughts of harming yourself or the baby, please notify the healthcare provider immediately. And if your breasts feel painful, swollen, hot, tight, itchy, or have sore spots with redness or red streaks and flu-like symptoms, also notify your provider. I have a few more, I'm sorry. So you might feel sharp pain, abdomen in your breast or chest, immediately notify the provider. And if you have any trouble breathing, dizziness or fainting, crying spells or mood swings that feel out of control, or you're unable to empty your bladder or urinate that's painful, difficult, too frequent, and having a difficulty having a bowel movement, notify your provider. It's recommended to report if you have any troubles with your spouse, such as domestic violence or abuse. Please call the 1-800 hotline. It's 1-800-96-abuse. For your infant safety, it's recommended when you're placing your infant to sleep on their back and use clothing such as a one-piece sleeper instead of a blanket, and do not let anyone smoke around your infant. Use a firm mattress and a safety-approved crib covered by a fitted sheet. Car seats and other seating devices are not recommended for routine sleep. Do not use pillows or blankets or pillow-like bumpers in your infant's sleeping area. Wedges and positioners should not be used, and keep soft objects such as stuffed toys and loose bedding out of the infant's sleeping area. The infant should not sleep in the same room as the parents. The infant should sleep in the same room as the parents, but not in the same bed. Avoid covering the infant's heads or overheating. For use of the bulb syringe, keep the bulb syringe near the infant at all times to clear the infant's throat or nose if necessary. Clean the bulb syringe with warm soapy water after each use and allow to air dry. For hand washing, wash your hands prior to handling the baby. For car seats, all infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. In the home, the use of outdoor announcements is not recommended to announce the birth because they call attention to the presence of a new infant at home. Questions of any unfamiliar person visiting your home or inquiring about you and your baby after discharge, and do not use home monitors or commercial devices marketed to reduce the risk of SIDS. For behavior, it's crying. It's a normal response for your infant to cry, and the most likely cause for crying are hunger, need for a diaper change, or need to burp. You should burp your baby after each feeding. Calming techniques to include feeding your infant is calming techniques to include in feeding your infant, changing the diaper, gently rubbing the back or the tummy, walking with your infant, rocking your infant, skin-to-skin contact, or giving your baby a pacifier. It is never okay to shake your infant. If you get frustrated or angry, put your infant in a safe space and take a break and call a friend. For sleep patterns, your baby will require lots of sleep. You should be waking your baby at least every 3 to 4 hours for feeding, and you should place your baby on his or her tummy each day for supervised tummy time. This will strengthen his or her neck and abdomen. Diet. So, for breastfeeding, your infant should breastfeed 8 times a day per infant cues. Positioning. Be sure to hold your infant close while you feed. Your infant needs to be cuddled, and skin-to-skin time is recommended. After feeding, hold your infant upright over your shoulders while gently patting or rubbing his back to burp. If you're feeding formula, your neonate is receiving Similac or Enfamil diet. If your baby sleeps longer than 4 to 5 hours and misses a feeding, awaken your baby to feed. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life, and you will need to eat every 3 and will need to eat every 3 to 4 hours. Positioning. Be sure to hold your infant's bottle to feed and burping. Burping. Infants need to be burped about every half an ounce of formula. After feeding, hold your infant upright over your shoulders while gently patting or rubbing his back to burp. Newborn characteristics. A newborn rash is normal for your infant to develop a rash on his or her skin, and it appears with a small red circular area with white dots in the middle. This does not require treatment and would generally resolve on its own after the first week. It's recommended that you avoid lotions, powders, and perfumed soaps. Milia. So milia are the small pearly white bumps on the face, usually around the nose, and they disappear within the first week of life. Don't pop them. Jaundice. So jaundice is a common occurrence in newborns, and your infant may appear to have yellow coloring to his or her skin, and it will start in the face and progress down to the toes. If your infant appears more yellow in the next 24 hours, you need to call your healthcare provider immediately. Infant care. So for bathing, your infant will need to be sponge bathed until the umbilical cord falls off. Using a soft washcloth, plain water, and gently wash your infant's face and bathe your infant from head to toe, saving the diaper area for last. Mild infant soap may be used on your infant's body. For cord care, keep the umbilical cord clean and dry and cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin when with diaper changes, and notify the pediatrician if drainage or discoloration is noted. The umbilical cord will generally fall off within 2 weeks of life. For wet and dirty diapers, it's normal for the baby to have 1 to 2 wet diapers on the first day or 2 of life. Then you should expect to have 6 to 8 wet diapers of pale urine every day. Over the next few days, your infant's bowel movements will begin to change from a yellow-green to a mustard yellow and will soften in consistency. Your infant should have at least 1 bowel movement every 24 hours, and you may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. For genitalia, for female babies, always wipe front to back, and be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. It is normal for baby girls to have a white or pinkish discharge. These secretions are normal and will gradually disappear. For uncircumcised male, always wipe the baby front to back and be sure to clean the creases and folds to prevent the diaper rash. Pat dry and diaper. For males that are circumcised, again, wipe the baby from front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and diaper. Vaseline gauze is applied to the circumcision with every diaper change for approximately 24 hours. The head of the penis will appear red initially and then will change to have a yellowish sticky film. This is very normal. If you see any bright red bleeding or green drainage, you should contact your healthcare provider. The plastic ring method of circumcision does not require dressing, and the ring that is used will come off usually by 2 weeks. If you notice swelling, bright red bleeding, green drainage, you should contact your healthcare provider. To cleanse the area, gently wipe with a soft washcloth, cotton swab, gauze pad, and plain water. For dressing, dressing your infant as you would yourself. Avoid overdressing your infant too much clothing, too many blankets may cause your baby to become overheated. And vaccines. Your infant should receive all the recommended vaccinations per your healthcare provider. Do you have any questions? No? Alright, I'll let the doctor come in and he'll discuss some things with you. Let me know if you need anything with the call bell. Thank you.